Okay.
Are you okay with that, Nazanin? So we'll wait. Is it recorded now? Okay, we're starting. Okay. Well, okay. So the webinar has officially started, and thank you everyone who is here, and especially thank you to our great doctors for taking the time, for giving us this presentation on the situation and update on COVID and the Delta variant. I especially want to thank Nazanin Mehr, Dr. Nazanin Mehr, because she is working so hard in intensive care right now, and took some precious time off for the RIF community. So thank you, especially Nazanin, and thank you to Dr. Aissatou Diallo. Maybe you want to wave, and David Sabino. So what we're gonna do is, like, each of you, if you can just very briefly introduce yourself and your area of specialty, where you are working, working now or back at home. And then I will proceed by asking you a few questions we received, from the registration. And then, of course, this way there will be more people joining in and everybody can ask also, their question. So Nazanin, we're going to start with you.
Okay, very well. So my name is Nazanin Mehr. I'm a proud member of RIF since almost 6 years ago. I have learned so much, and RIF has helped me a lot. So it's a very, very small gesture and very small part. I would love to, give back more to this great organization. And I'm trying to do that hopefully in the future. So my specialty is internal medicine. Currently, I'm a third-year internal medicine resident at Flushing Hospital in Queens. I have done most of my training during this, I would say, like, very, very disastrous pandemic, which have taught us all, I'm sure, a lot about everything in life. Yes, I would say maybe 6 months into my training, the pandemic hit, especially in New York, and especially the highest amount of casualty that we saw was in the borough of Queens, which my training hospital is located at. We have seen stuff that we never thought that we're gonna see. I just don't want to scare anybody, but the day that they announced the FDA approved emergency use of Pfizer vaccine was one of the happiest days of all of my colleagues and all of us, our lives. In terms of the questions that you wanted to ask,
Nazanin, let's have everyone else to present themselves, and then we will go to the question. I will repeat the question so that it is on, recorded as well. If you could hold on 1 second. Thank you, Nazanin. Thank you. You really,
thank you, Nazanin.
We applaud you. Really, you are our hero for sure. So, Dr. Diallo, if you would like to present yourself.
Yes. Hello, everybody. My name is Dr. Aissatou Diallo. I am neurologist.
Yes.
Yeah.
Okay, we don't need to translate. Yeah, that Aissatou is a neurologist. No. That's also very, wow, that's really impressive. Yes, because great, thank you. And Dr. David Sabino, would you like to introduce yourself?
Okay, hi, my name is David Sabino. I'm a dentist in Venezuela, not yet here in United States. That is the goal. But well, I'm working here in the United States like a dental assistant, so I'm in the field. So that is a good thing. to be for a asylum seeker, I believe. So I feel very proud. I feel honored for this invitation. So, well, if we can help, that is a good thing.
Thank you, David. So, yes, thank you to all our doctors tonight.
Oh, well, and I was like Nazanin. I was working all the pandemic in the dental office, and it was scary, but here we are working for the people, you know?
Yeah.
Yes.
So, okay, well, you know, let me just start by asking, and if each of you have, you know, your recommendation, very briefly, is about, you know, we received a lot of questions about the safety of children. You know, a lot of mothers and fathers are worried about having their kids going back to school. And the question we had is, you know, is it safe to wear a mask for a children? And, you know, some mothers said they are afraid their kids will lose oxygen, you know, they will. And then some other people, they were concerned, what about if it's not safe? I mean, if it's safe if other people don't wear a mask? So maybe if you would, you know, the three of you, and I will ask Nazanin to start with this those questions.
Mm-hmm. Mm-hmm. In terms of children wearing masks, let me just explain how it works, at least in our city for now. So basically, whoever is vaccinated fully, meaning 2 doses of vaccine, whichever vaccine that they took, if it was a 2-dose vaccine, they took it at a certain time. And if it was a 1-dose vaccine, they took it and they have their, you know, identification. They are not, you know, required to wear a mask in like outside, outdoors when they're going anywhere. But indoors, they're still required. Children or adults, they're still required to wear masks indoor and public transportation. This is after the surge of the new variant of the COVID that this basically guideline came. In terms of children, any child older than 2 years old is technically advised to wear a mask, and especially in indoor areas, in public transportations, indoor dining, school, anywhere. They're advised to wear that, and they're advised to practice that social distancing and have the minimum of 6 feet separate from their colleagues. And the children and the teachers also have to have that distance and also required to wear masks. In terms of oxygenation, there are certain very, very rare instances that the schools will allow children, if the mask is not safe for them, to just do not wear the mask, but still they have to, you know, basically go by all the other precautions, meaning that 6 feet, require frequent washing of the hands, disinfecting the hands, and being away from other children, and practicing social distancing. But it's very, very rare. Like I haven't heard, unless they're not, like they're so small, like maybe 2-3 years old, and they cannot hold a mask, that it has caused a trouble, or maybe the mask was not, you know, the correct size, or the mask gave them an allergy, the fabric of the mask was not correct. But other than that, no, and there's nothing officially basically has been out, as far as I know, in regards to children. And as far as we know, the vaccination is already, at least with Pfizer, is approved for children over like young adults over 16 years. It's approved 2 doses. And also I was looking at the new CDC advisory that says over 12 years of age, they recommend vaccination. If the child is younger than 12 years, depending on the neighborhood, depending on the rate of the vaccination in the area that they're living at, their association with people with who were diagnosed with COVID infection, they need to either quarantine or get frequent testing, and basically requires, again, going with all the protocols, washing hands 6 feet apart, mask up as much as they can, except for the outside areas, probably for the children less than 12 years of age.
Great.
So that is something about the children that, as far as I know, and we basically tell our patients.
Yes, great. Thank you, Nazanin. I'm going to let also Dr. Diallo to also maybe give her recommendation as well on this topic. And
yes, I'm just joining Dr. Nazanin because the masks are safe and effective for anyone under 2 years old.
Mm-hmm.
Yeah, they are made from is safe. You understand?
yes.
Yeah.
Okay.
And the other thing that I wanted to add is that if people are wondering about the kids that they cannot breathe, or the oxygenation is going to be less with the mask that is just a layer of a cloth, or maybe the shield, they just have to realize what will be the alternative. Although it might be, we haven't seen serious cases in young adults, even serious cases in maybe below 30 years. So far, most of them were like over 30 and 35 years. But the thing is that what is the alternative? If God forbid they are infected with it, and that will be the real deal, and the oxygenation is going to be very much decreased, and it's going to be permanent. At least the mask is what we're hoping for is temporary.
Dr. Sabino, would you like to say something about this?
Even, I was looking some articles, even the flu, all these kind of pathologies, and getting down, and because the use of a face mask. So I believe it's a good thing. It's gonna be with us for a long time, and I don't think about the oxygen is gonna affect the little kids. It's even better for them.
Yes. Okay, so our three doctors, I'm sorry, Dr. Diallo.
Yeah, Maria, I want to talk in French, please.
Ok, Fabienne va traduire.
Bien sûr.
D'accord, Fabienne. So, le port du masque n'a pas d'effet pour les enfants. Ça n'empêche pas l'oxygène de venir. Il peut très bien respirer, à moins qu'il ait un problème respiratoire. Dans ce cas, il faut demander l'avis de son pédiatre.
OK.
Sinon, OK, vas-y.
So Dr. Diallo is clear about the fact that wearing a mask is not a problem for children. It's safe and it's effective. It will not affect the oxygenation level unless the child has a respiratory issue, in which case the advice of a pediatrician should be sought and that should be followed.
Je vais ajouter que les masques sont fabriqués avec toutes les précautions pour bien permettre la respiration.
Yes, so the mask, the production of the mask is made in such a way that it takes into consideration these issues, and they really allow for a good oxygenation.
Good breathing.
Good breathing.
Yes. Yes, Gabi, yes. Well, at this point, would anyone like to make a comment about this issue? Please feel free to do so before we talk. I see, Gabi, you have something to say.
So mostly of our work is based in schools, in public schools in Brooklyn. And it's more worrisome that the age cohort of parents are between like 22 years old and 35 years old, and they have been very hesitant to even being vaccinated themselves or allowing their children that are older to be in compliance with schools mandates about protection. Even though the kids are mandated to wear the masks, they are not as compliant as they should be, right? I got the virus in March, after March 15, and I'm sure that I got it in the school.
Ah,
While I
okay.
was teaching. Yeah.
Yeah. Do you have a question, Gabi, that you would like the doctors to address on exactly this issue?
Yes. My question is for the parents that have these questions all the time about vaccinating children over 12 years old. What is the age of children to get actually vaccinated?
Sorry, do I?
Yeah, go ahead, Nazanin. So we'll go Nazanin, yeah, no, Aisha,
So basically, Pfizer vaccine is approved for any person above the age of 16, and CDC guidelines, because of the start of this new variant, advises, doesn't necessarily say which vaccine, but advises to vaccinate above the age of 12, start vaccinating. So I would say that's a very good news for people who were waiting to get vaccinated, and it wasn't in their age group, it wasn't recommended at that time. Even at some point, pregnant women we're not sure if they can get vaccinated or not, and we see that CDC very freely says they recommend it, that they need to be vaccinated. And if you ask gynecologists, OBGYN doctors, they most of them recommend the vaccination even during the pregnancy. Because I remember the time that they were saying, oh, either get vaccinated after or before pregnancy, but now during pregnancy, because of the risk of a severe infection with COVID in pregnant women and 40 days after delivery of the kid, they have seen more serious infection because of the pregnancy causes your immune system to become a little bit weaker so that it allows for the child to grow. So once you're infected with something like coronavirus in that state, it's going to have a very more severe effect on you. So that's why they're saying anytime during the pregnancy, it's better to take it than not to take it.
Okay, thank you so much. Dr. Diallo, did you have something on these points, on those points?
Elle a très bien expliqué ça. En ce moment, les femmes enceintes peuvent prendre le vaccin à n'importe quel âge de la grossesse. Il n'y a pas de contre-indication. Yeah.
So Dr. Mehr explained it really well. At this point in time, it's fine and safe to be vaccinated while you're pregnant. At any point of the pregnancy, there are no advice against it.
Yes. Thank you. Dr. Sabino, do you have anything to say on this issue?
No, I'm allowed
Yeah.
the doctors.
Yeah. Yeah, I think, Gabi, if I understand right, you were concerned about the young parents, right? That are, maybe you were saying that you are in your school, there are a lot of young parents. They are 22,
the age bracket between age 22?
Yeah, including like between like 20, the youngest 19, 20 years old. They had the children when they were like 14 years, and they start like kindergarten during the 5 years, when they're 5 years. And including like vaccination is, even for people that are crisis counselors, are still hesitant to get the vaccine. You know, but I thank you, doctor, for explaining about the 12-year-old, the 12 to 16-year-old recommendation for vaccination.
Yes, yes.
And let me add something else about the young parents of these kids. The only thing is that we have to see what is the basically guard they have. I'll see that in our patients too. Obviously, it's not mandatory for all the citizens, but at least New York has made some steps. New York and Connecticut, I'm aware of. For the healthcare workers and for many of the employees to be mandatory to be vaccinated in order to be able to work. I'm not necessarily agreeing with it being mandatory, but as somebody that is working, in hospital and have seen firsthand what did that pandemic do to people that if it was for vaccine, or if they had the vaccine, could have had a probably normal flu or something a little bit more severe than flu and would have made it. I don't see the hesitation. And I think it's just more education, information, facts that they need to be exposed to. And the other thing is that they need to understand something about herd immunity, meaning that if they are safe, the chance of them, 21-year-old, 30-year-old, taking this, taking this virus, specifically the more dangerous variant of this virus, home to their parents, to their grandparents, or their children bringing it home, is going to be reduced. And in terms of children lower than age of 12, the only thing is that they need to just practice the advices from the CDC till there will be a solution for them too. And if they are around or exposed more than 15 minutes to a confirmed case of positive COVID-19, they have to be removed from the school. They have to be in isolation, unfortunately, for 14 days, even the children, and be tested till their test is negative, so that they don't basically carry that virus and, for example, giving it to the people that are, less immune, have some underlying condition, they're elderly in their community or in their house.
Yes.
But,
yes, doctor, I believe you have a big point about the education. It's super important for all the people get educated about all the situation, about coronavirus, about the step you need to follow, like wash your hands, and the seat fix, everything is so important. And I believe people need to be educated and about the virus itself by itself, because they don't know what it is. They believe it's like something there. At least I heard people who doesn't believe in the virus. So it's a reality, it's something real. And that is important to let the people know.
exactly.
Yes, it looks like it's sometimes I think it's like there is two competing information, is that people have information. There's a lot of information, but unfortunately, in my opinion, the wrong information is also convince people, you know, and we will talk about that. So I'll just go to my next two questions. I have maybe two doctors before we talk about the dentist, you know, the safety issue with dentists. So Dr. Nazanin and Dr. Aissatou Diallo, there are also questions, this is more for adults, you know, that we're saying, is it safe to go back to work in a place when other people are not vaccinated? So they're worried about that. Mm-hmm. And then finally, some people ask, I mean, the second question was, if you take Moderna, for example, can you take after Pfizer, you know, I mean, can you take two different vaccines? Mm-hmm. So I will start with Dr. Nazanin, if you can answer those two questions, and maybe Aisha, you could also give your recommendation as well.
Yes, okay. Dr. Nazanin, you first. Go ahead. No problem.
So basically, in terms of the people around you or your colleagues not being vaccinated, first of all, we don't have all the data, all the information about people. We wouldn't know who is vaccinated, who is not vaccinated. So I would still recommend to be cautious around people. And as I said, if you're working in an indoor area, closed basically environment, to wear your mask, practice that social distancing, don't get too close and friendly. Try to wash hands as often as possible. Always have the hand sanitizer with you. If you're working with laptop, if you're working with something that is a public use device, try to sanitize it before, you know, getting comfortable and using it. These things might seem a little bit mundane, but they actually have shown that they are controlling the risk of transmission of the virus, especially if you have one of those wipes that has alcohol in it and it's disinfectant. It doesn't have to have like chloride or bleach, but it has to have at least alcohol and certain amounts of disinfectant to wipe the surface for you, at least for those couple of hours that you're working, if you're working at a desk job. And obviously wear your mask. And as you know, this virus gets transmitted through the nose, through all the mucosal area of the body, basically eyes, nose, and mouth, basically, because it's a particle and droplet. It's a droplet. So many people like take it further a little bit, and they have shields or they're wearing glasses. So that's actually a good thing too. It might be a little bit too much, some people think, but it actually has shown that it reduces. And I would say most of all, just always sanitize hands and try to stay away, like have that social distancing in closed areas, because you are vaccinated, but you still are, you know, exposed to other people. But if you're outdoor, currently CDC doesn't recommend you to necessarily wear your mask. But the other people who are not vaccinated and are basically exposed to a person that is confirmed COVID, there are different stories. They have to do everything by the book. They have to quarantine, they have to not see anybody for 14 days. But if you're vaccinated, even if you are exposed to somebody that is COVID positive, and you know that that person not only is unvaccinated, but has COVID at the time that you were in contact with them, at least close contact with them for 15 minutes and more, the recommendations are different for you. It's not 14 days of quarantine. It's basically, if you're asymptomatic, you go about your way. And if you are getting a little bit of symptoms, you're just going to get tested 3 to 5 days after your exposure. If your test is positive, obviously you're going to quarantine. If your test is negative, then you go about your way. So that's as much as we know about the interaction between vaccinated and unvaccinated people. And the other question was,
can you take two different vaccines?
they don't recommend you to mix vaccines together, because not specifically because they're different, one is better than the other. It has shown that at least these two that are the most famous ones in the United States, they work the same, even in the fighting against Delta variant, they're the same almost. That is because the number of the days gap between the first dose and the second dose, based on whatever analysis that they have done, is different. For Pfizer, it's a little bit shorter than Moderna. Mm-hmm. So that's basically it. That's why they're recommending, and they don't recommend mixing it.
They don't, I'm sorry?
They don't recommend mixing these two vaccines. Get one and get the other one from another company.
Yes.
Plus, if you have already taken one and your body is adapting to that one, the dose is going to be the same as first vaccine, and preservative, everything is going to be the same. So you would want to get that one.
I'm sorry, my video stopped working. I don't know my camera. I apologize.
Marie, I think it's just the lighting.
The lighting.
Lighting, yeah.
Lighting? Okay. So listen, maybe Dr. Aissatou Diallo, would you like to say something about people who are concerned, to go back to work, and, of maybe colleagues or other people around them who are not vaccinated?
Yes, of course, Maya. So for this COVID-19, you must believe it, because it's real and very bad. This COVID-19 is even bad for the people who underestimate it. We all remember about Donald Trump's case, and recently the Texas governor, they all were victims of COVID while there was arguing over mask mandates. I'm so sorry for this example if I offend anybody, but it's real. COVID-19 has no limits. Whether you are president or poor citizen, whether you live in Africa or in America, or even in the White House, you still can be a victim. That's why I recommend getting vaccine and wearing the mask for stay safe and healthy about this COVID-19. You protect yourself and the people around you.
Thank you. So we have two more questions, and after really we would like people to ask their question. The one question is, Dr. Sabino, what do you recommend? People are scared to go to the dentist. Do you think it's dangerous to go to the dentist, because there really you are very close and a lot of droplets?
Well, no, don't be scared. Just all the dental office, we receive a memo or something like that, where the step we need to follow, what we need to do with this COVID situation. We always have careful with different pathologies like a VHI, different. So it's the same thing. We follow the same rules, but even better. So don't be scared. You just need to be careful, see if the staff is cleaning everything, double ask. I always say to my patients, please ask, don't be scared. Ask about if this is clean. Don't be scared to ask, because it's your health, and that is the first. And of course, we wipe, like the doctors say, we need to wipe all the handpiece. We need to sterilize all the instruments. Don't be scared. If you have big infection, you need to go to the dentist. Don't wait. I always say to patients, it's better to prevent. If you prevent, everything is gonna be better. So go every 6 months to the dentist. Don't be scared. Ask if everything is wiped, if everything is okay. Don't feel bad about ask. And all the healthcare workers are doing the same. We are taking care of us and taking care of you, of the patients. And I believe it's the beautiful part of this career. And I'm not working like a dentist here in the United States, but I feel like I'm helping people, like a dental assistant. And well, that is what can I say. Always go to the doctor, to the dentist, to every healthcare you need, because your health is first. If you don't have health, you don't have anything. And that's it. So take care of you.
Thank you. So we're going to leave it to questions at the moment, and we'll have a final question that is a very, I mean, I think a question that I really hope you guys, doctors, will also answer. Gabby, Gabby, you wanted to say something?
I think actually Saskia had a question before.
Cassidy.
So that question was why some people are getting the vaccine and then are still getting the virus afterwards.
So basically the vaccine, ever since, I remember ever since it has been approved for emergency use, and after that, after the data that they collected and the researches that they've done over the year, never promised no infection. The only thing that it promised is an immunity to a severe infection and death and casualty, basically. So you might get infected, such as my colleagues, many of them got the vaccine, but they were exposed because they were taking care of these patients and they got the flu-like symptoms and they were out for 14 days, but it didn't get beyond those, flu-like symptoms or common cold symptoms. They were just a little bit tired. They had some muscle pain. They might have had some fever, some cough, like viral infection that many of us during the fall, at the end of the summer, fall and winter would get and have experience with it. But the only thing that it promised is that the rate of severe infection and your hospital admission and intensive care unit admission and God forbid death is going to be much lower than the person that is not vaccinated, such as now we're seeing the cases, and I actually admitted a case today, and that case that ended up coming to my unit, which is an intensive care unit for very sick people, was a person who unfortunately did not get vaccinated. So, and this is a case that we see in some of the southern states right now. We see in Texas, we see in Florida, we see in North Carolina, some of the Midwestern areas, we see Iowa, Wyoming. These are the places that the rate of vaccinations were much lower. And I have colleagues there that basically are experiencing the same situation that we had with the first wave of pandemic in New York, which was in 2020. It started in March, around, I think around like mid-March, end of February, I think, to mid-March. And then it was really bad till June, and it sort of slowed down a little bit, and again picked up by the end of summer, and hopefully, like it was like gladly we had that Pfizer vaccine in December. So that is that. So you might be positive, you might be asymptomatically even positive. That's why they're recommending that in closed areas, you still have, even if you are vaccinated, you still have to protect yourself and others and wear masks and socially distant, because the rate of transmission, even if you are not sick yourself, you might carry it to a person who is not vaccinated. So they're basically thinking of the unvaccinated people too when they're telling you you have to wear your mask in the closed environment and indoor areas. So that's the story with why some people get the COVID after even having the vaccine. Yeah.
Yes. Cassidy, is there other question that is coming?
So we have Aisha, I believe, has their hand up.
Okay.
So I'm not sure if they have a question they want to ask directly, but I just wanted to acknowledge that. And if not,
She's muted.
yeah, it might have
yeah,
just
I'm
been
sorry,
an
I was muted.
That's
I have a
okay.
question.
Okay.
Aisha?
Yeah. So from what I heard, like almost everybody, for safety, for the matter of being safe, is supposed to get the vaccine. So I just wonder, for people who cannot have it because of their beliefs, their religion, what kind of future are we going to, those people are going to have? Are they going to be wearing the mask forever, or they are just going to be put aside?
That is a tough question to honestly answer, because we, as healthcare providers, are hoping for the number of vaccination to go high and high, go above 90%. Right now, I think New York State is above 70-75%, which we see the difference between,
states.
Yeah, New York and, for example, Florida, we see it. How many new cases they have versus how many new cases we have in our state. So that's a tough question to answer. What's going to happen to them? As I explained, there are unimmune, and that percentage of immunity that the vaccinated people have, they don't have. And even vaccinated people can, as I said, be asymptomatic and be a carrier and transmit that to them. So they need to be, for whatever reason, first of all, I would, try to just basically educate them, inform them, try to, give them scientific reasons why it is beneficial to get the vaccine, and ask them if they have gotten childhood vaccine, diphtheria, for example, pertussis. Like it's the same scenario, it's the same argument. And if it's like a very restricted, like they're very strict about this idea, I would foresee social distancing and masking for quite some time for them.
I want to include too the part, wash your hands 20 seconds, because that helps, because like the doctors say, we can carry the virus and we are asymptomatic, like a vaccinated people, or like a simple, like a people who has the antibodies, they are asymptomatic and they carry the virus from one place to another place. So we need to think in other people too, and be careful. I know we are tired to use the face mask and use a lot of stuff, but I has been working like a dentist since 2010. Oh well, and I use the face mask for all that time. So we're gonna get used to it, believe me. It's not the right thing. I believe, but it's for our health.
Yes. And Dr. Aissatou Diallo, please also, can you address, I think this Aisha was asking about your religion belief and how you do, if you have this, this kind of, your religion tell you something, but then let's say the science says something different, how you make those.
So, je veux répondre ça, mais laissez-moi parler
Oui,
en
d'accord,
français,
bien
s'il
sûr,
vous
bien
plaît.
sûr.
Au fait, entre la religion et les choses scientifiques, il faut peser ce qui va dans ton intérêt. Et là, il est question de sa vie. Donc, quand il est question de ta vie, je pense que la vie est meilleure que tout. Les premiers souhaits qu'on souhaite à une personne, c'est la santé.
Oui. Fabienne?
Voilà.
Annie, je vais traduire un peu Dr. Diallo et vous continuez après.
Oui.
So in the matter that's at hand here, basically when you are weighing the options that you have between what your religious beliefs are and what the science tells you, you have to really take into consideration your own interest and to basically consider that your life is at stake and your health, and that should be what is governing your decision. Allez-y, continuez.
Par rapport au vaccin, nous savons très bien que les vaccins sont très efficaces pour nous protéger du virus, mais il est toujours possible d'être infecté avec des symptômes légers cette fois-ci ou presque inexistantes. Bon, si vous tombez malade, malgré que vous soyez vacciné, les experts disent que les injections aident à réduire la gravité de la maladie. La principale raison de se faire vacciner. Alors, prenons le vaccin.
So in the case of the vaccine, we know that the vaccine is very efficient in protecting us against the virus. If we are infected after being vaccinated, it's going to greatly reduce the incidence of the symptoms and the severity of the disease. So we know it's working, and that's why we need to get vaccinated.
Thank you, doctor. Any other question that we see, Cassidy, or anyone wants to say something right now?
So we have two questions that have come up in the chat. So one is, what is the Delta variant and how do we simplify that to the community? I'm guessing, how do we simply explain the Delta variant? And the second question is sort of related, so I'll just go ahead and piece it in, which is, how are the symptoms different from the standard strains of COVID-19 versus the Delta variant? So how do we simply explain the variant, and how do the symptoms differ?
So viruses in general, whoever studied virology has always, like our attending, whoever taught us something, they're always saying that viruses are very smart, very smart creatures. So whenever they see, and they basically need a host, which in this case is humans' lungs or humans' body in general, in order to survive and replicate. And they're very smart. When they see something is attacking them, something is breaking their reproduction cycle, and they sort of try to go into, so to speak, camouflage. So they change their shape, they change the protein, they change something around so that they can just not be unknown, sort of masking themselves, putting a mask so that they're not recognized either by the immune system or either by the drugs that we're giving to break their cycles of replication. So in this case, from the beginning of the pandemic, there were multiple drugs, multiple drug trials that we tried, and many of them have been effective in saving patients, and they were like our victory stories, and we were so proud about it. And but virus was not, resting, and virus also was coming on with the tactic, because it's a sort of like a war. So they tried to change their proteins, tried to change their shape, try to basically escape from these drugs and immune system, and they're basically mutated. And this variant is the mutated form of original coronavirus, and it's called Delta variant, which unfortunately is a little bit more dangerous. It is more contagious. It can basically, if it was, for example, one person can infect 3%, now it's one person can infect 6, 7, or 8%. So it just goes faster and it spread faster. That's why we see what we see in other countries, in Middle East, in my own country, and in some parts of America right now. So that's basically the story of the Delta variant, which fortunately we see again with the people who have taken the precautions, who have vaccinated. They might get Delta variant, but they're still see the symptoms very, very mild in terms of severity of the disease, getting admitted to the hospital, oxygen requirement, survival, chance of survival, all of that stuff is much, much higher than the people who have not taken the vaccine. And so basically this is what Delta variant is, and the virus is not going to stop even here. If you come up with something to throw at this variant, it's going to try to replicate and change itself. That's why we see with the seasonal influenza as well, with what we see with corona. So that's it. That's their nature, and that's, I guess, our nature to come up with a solution to cut their cycle.
Yes.
The best option so far is to not be their host, because once you're their host, they're gonna replicate, and they're gonna just go from this person, this host, to another host. They're uninvited, I guess, guests that you have to.
And the good news is the good news is the vaccine, Pfizer, Moderna, is helping against the Delta variant. So it's another reason to be vaccinated, I believe.
Thank you. Another question, everyone, or someone has another question? So I'm going to ask one question that came, as someone who had registered. And he said that he had heard that the vaccine will kill people after 2 years. So he was wondering about this information. And also he also made a comment that maybe it was the way for the government to control the world with this vaccine. So maybe our doctors can give us their response.
I thought of something right now. So how about wait and see? I was one of the first people who got vaccinated. I think it was the Pfizer was approved maybe in, if I'm not mistaken, December 16, and I got it in December 19.
Wow.
So how long do we have till December 19? I think it's going to be
almost 2 years.
Almost.
No, 1 year. Okay.
1 year.
I guess we have to still wait.
Yes.
2020, 22.
But you never heard about this thing about people dying?
No. I've heard about chips that are implanted and some other.
I heard about chips too.
I heard about some stuff that I don't know. I don't want to. I don't think it's.
It's a war. Really not just a war.
Dr. Diallo?
En fait, je me demande où lui, il a pu avoir ces informations. Et si ça s'avère vrai, ça veut dire que beaucoup de personnes vont mourir alors.
Oui.
Aussi vite que ça, parce que les gens sont fait vacciner quand même.
So the doctor is wondering where that person read that information, and so that would mean that a whole lot of people are going to be dying very soon. And doesn't seem to make sense.
Gabi?
What I wanted to say is, like, we not just have a war, actually a war with this pandemic, but we also have a pandemic with misinformation that is happening.
Totally.
It's not just what is happening and what this virus is making is making to us and our bodies feel, and our families and our communities, but also the misinformation is as hurtful as the virus itself, or even worse. The thing is how we can engage people into critical thinking, and also wonder and second guess everything that it comes to the lab, everything that they get in like, we live in a different world of technology. Social media, Facebook is a war with misinformation as well.
Yes, yes.
Right.
Yes, because
there's another thing that I was reading. You don't see any hospital, not only mine, any hospital full of people from side effect of the vaccination. You see people full of, you see patients full of COVID-19 and with severe sickness that are mostly unvaccinated. The proof of it is one of my colleagues in Florida right now who actually is in intensive care unit, and he says 95% of the people with severe illness that they're trying their best to care for them are unvaccinated. And so far, whatever patient case that I have seen have been unvaccinated, unfortunately.
This morning we got a meeting in RIF, and I was talking about how my experience because I'm from Venezuela in South America, and we don't have the vaccines. We have just the Chinese and the Russian, and it's not enough. And the people are paying $200 to get the vaccine. They are paying because they don't have access to the vaccine. And here in the United States, you can get it by free. And even they paying.
You're paying.
I heard the news. They are paying like 100 or something like that. So I believe it's a good country. You need to take an advance of that, because some people, some towns, some countries don't have
the
vaccine. And I believe we need to believe in the science, because that's why we are here. That's why the humanity is getting better. I believe so. So we need to put in the, I don't know, we say in Spanish, in the shoes of another people sometimes. I don't know if it's the same here in the United States. It's the same idiom. But yes, that's why I want to share with you guys the experience in my country. Yes. So I pay to my father, Dad, go ahead. And I pay the $200 for the vaccine. Don't worry, it's your health. It's better than see you die, you know? So I think we need to believe a little bit.
So everyone, I just would like to introduce to everyone here, Dr. Madeleine Miller, who is heading our support group every Monday, and maybe Madeleine Miller would like to say, and also Tanzelia Oren, she hears us, and if she can be on camera, because she is also our RIF education advisor, but I think that maybe she's busy, or maybe she will come. Here, Tanzelia.
Yeah, hi.
Madeleine, would you like to say something? We are going to finish pretty soon, but.
Sure. Yes, I want to welcome everyone to the Monday morning groups. Everyone is welcome. But before saying more about the group, I am so pleased to be listening to the three of you, RIF doctors, dentists. How wonderful to learn from you. And to know that everyone can take your information home and speak to roommates and partners and neighbors. That's really wonderful. So just to say one or two words about the group. Everyone is so welcome. The group is for an hour. People have a chance to share struggles and accomplishments, and most importantly, to support one another through understanding of just what their experience is, what someone else might feel, even from another country, another circumstance. And I have a sense that people take that sense of support home with them after the group. So, so glad to be in that role to listen to group members. Thank you.
Thank you, Madeleine. Tanzania, you want to say something a little bit about education?
Yes, I'm at RIF. I'm helping people with education choices from courses to college and what to do with foreign degrees or how to start college in US, how to find funding. So you're welcome to talk to me separately. Yeah, so it's, and I know some colleges and courses still online, some in person, so it's a big adjustment. And I think we're still in the middle of pandemic and it's getting worse. And I just wanted to say that colleges and universities in New York require vaccinations from all students and all instructors, and they test periodically. So, I mean, it's maybe safer to go to adult education if you have questions about that, but that's a requirement now. So that's what I know. But you're welcome, please, to come and speak to me about any educational services you may need.
Mm-hmm. Thank you, Tanzania. Well, maybe I think we're coming towards almost the end. So any last questions, comments?
I just wanted to say I agree with Dr. David and Dr.
Diallo.
I can't say it. Aissatou. Aissatou. And there are countries, meanwhile, we're so privileged that we're getting the vaccine for free, and they're basically sort of giving us a gift to just get vaccinated and control this pandemic. There are certain areas in this world, such as my own country, Iran, that there are over 500 people daily dying because of the shortage of the vaccine and because of the, unfortunately, lack of vaccine and public vaccination. They are dying, and unfortunately, they are young. They are 20.
Yes, totally.
They are 30 years old that are dying. There are mothers. There are students. So that is honestly unbelievable to me that people are offered, and some of them have still doubts. We've seen the numbers, but we're hopeful, and we'll see that New York has made a huge progress, and hopefully all the other states as well.
Yes. Well, on that note, we are going to end, but first we want to say a big thank you to our all wonderful doctors for this great presentation, each of you, and how, we feel privileged to have you as RIF members. And we are also very proud of Nazanin now having done going through the whole equivalency and being able to work. And I know that Dr. Diallo and Dr. Sabino are soon going to follow suit. I mean, Aisha just had a little baby, 2 babies very soon, so she is also very busy right now.
Oh,
Congratulations.
But soon, but really we thank you so much from the bottom of our heart to, you know, give us this explanation where we have the chance to ask questions and concerns. And
likewise, thank you so much again from RIF, Maria especially, Dr. Miller, who has helped me personally a lot during this time that I have been struggling and trying to find my own way here. I obviously, if anybody has questions, they can get my contacts and they can ask me. I would like to help them as much as I can. And if they have any other questions, I'll be happy to answer as much as I know.
thank you, Nazanin.
Thank you, dear RIF members. Thank you, dear doctors. Thank you, my dear Maria. I was very happy to talk with you about this pandemic. Thank you very much.
I would like to acknowledge also Gabi, because Gabi also has, you know, he is also, you know, came here seeking asylum several years ago, and now he's the coordinator of one of the largest city, you know, of New York City, providing social and emotional services, you know, for COVID. So say, Gabi, this is your agency is called Riceboro, right?
Riceboro Community Partnership, the second
Yes.
largest agency in Brooklyn. Yeah, so I work in Bushwick. I'm located in Bushwick. I work at the education department, which it provides prevention services. It's prevention holistic approach that we do.
And Gabi went to school, back to school here, went to did his degree here as a counselor. So he did everything.
I did everything thanks to Maria, because I touched RIF doors and they opened to me 2011.
And now Gabi and I are in neighbors. We live one street from one another. So we always see each other in the streets also.
I will say thank you to everybody. It's amazing. It's a good organization. You are helping me a lot, giving me good advices, and knowing new friends, you know, because we are alone in this country when you came in. But little by little, you're growing, and that is a good thing. I say thank you to Maria and to Tanzania, to Dr. Miller too, because it's amazing. It's an amazing group.
Well, listen, today, you know, you guys as doctors, I mean, you know, we just want to say thank you. You are really our heroes, and we want to wish you all the very best.
The same, dear Maria.
And we hope to see you soon for some good celebration.
Yeah,
Oh,
hopefully in
that
person.
sounds good.
And it will get better. Everything
Uh-huh.
will get much better.
Well,
Thank you so much, everybody.
Everybody, and
Bye.
And please
so
take
much.
care of yourselves and be careful meanwhile till we, you know, hopefully win everything.
We win.
back.
That's the good job, the good work. We
Yes.
win. We will win.
We will.
Thank you so much, Maria.
Bye, everybody.
Thank you so much, Dr. Miller.
Thank you so
Thank you,
much.
Dr. David, Dr. Aissatou.
Bye. A pleasure. A pleasure for.
A pleasure meeting everybody.
Bye. Don't forget the mask
Thanks,
and the
everyone.
vaccine.
Yes, please, vaccine.
Merci, Aisha.
Also educate other people.